physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we're the most famous physical therapists on the internet.
Oh, in our opinion, of course, Bob.
Like it just dawned on us. Today we're going to talk about what is causing your knee pain. Is it iliotibial band syndrome, ITBS, and how to tell? Again, quite a mouthful, Brad.
Yeah, iliotibial. It all makes sense if you break it down. Are we going to do that or just say?
Well, I think I think one of the best things right now, Brad, is just to show it because it's going to make the most sense. So you do have a muscle up here called the tensor fasciae lata, which is irrelevant.
Another mouthful.
Yeah, but a whole bunch of muscles here kind of attach into this band. This is a heavy, thick band. It's like a ligament. And, you know, I've heard the case made where you could probably lift a car with it. It's so thick and heavy.
Yeah, and it is wide like this piece of K-tape. And then it comes
wider
down.
up here.
Yeah, and then it goes up and it connects to that TFL, the muscle.
And also,
belly
I
of
think
it.
like the glutes, and it attaches to a lot of muscles.
And you can see it gives lateral or support to the knee on the side. So sideways it offers some support. So it can be a stinker though, particularly down here where the pain.
So it attaches
starts.
in this lower bone here, the tibia, this one right here, and there's a bump right there, and that's where it attaches, right there.
The lateral epicondyle, is that
If you want to find it on yourself, this is probably the best way. So here's the kneecap.
Yep.
And right below is the bump for the tibial tuberosity. There's a bump here. Now take your finger out to the side, and the first bump you find here, that's where it attaches.
Yeah, don't get confused with the fibular head.
Right, exactly.
But anyways.
Yeah, it's around this area because it's going to probably be hard for you to find.
Yeah, if you're not really familiar with anatomy, it's sometimes confusing.
So what it can happen is this band can rub across that bony area and become irritated.
Right. We have a bursa there?
I'm not sure. There might be.
Well, anyways, that's the location where the pain is.
Yeah.
Sorry to say that, Bob.
Yeah, you would think there would be a bursa. You know, the knee has so many bursas.
I know.
And there's some that are prominent, and there's some that are really small.
Yeah.
I mean, bursas usually help
For the
between tendon and bones.
Yeah.
So it would be unusual if it didn't have one there.
Mm-hmm.
But so the thing is, this happens quite often with endurance sports. Cycling. Did you know any cyclists that had? Well, yeah, you had your friend.
Oh, yeah.
Did
Dan. His bothered him with biking
and we thought it was
running.
his IT band, right?
And actually, with walking, his was so bad. But
right.
Anyways, yeah.
Weight training with heavy weights can bring it on.
Sure, up and down steps repeatedly.
Yep. So what you're going to find is it's very simple. You're going to find pain or stinging sensation felt over the bump on the outside of the knee. And again, that's where it's sliding over the bone. And you might also feel some swelling or thickening there.
Okay.
Again, you can just use your hands and diagnose this. We're going to show you 2 tests you can do, but it's generally the pain is most intense when the knee is bent to 30 degrees. Brad, do you want to show approximately 30 degrees?
So there's 30, there's 90 degrees, so we're going to go to about a third of that distance. So right about there, obviously it doesn't be perfectly 30. You just know you're in that ballpark.
Yeah, and what you'll find quite often is it may not hurt right away when you're doing biking or running, but after, the repetitive nature of it, and maybe after 10 minutes, then, kicks in.
Yep.
So it can be very painful. Like you said, you had that friend Dan who actually couldn't even walk after a while.
Yeah,
he had trouble walking across the street.
The good news is it's repairable. I mean, you can do some things to improve it.
Yes, and we're going to do that in another video, Brad.
Oh, we're going to hold back.
What may have happened is your hip abductor muscles may be weak. That's the muscles that pull your leg out to the side. You may be internally rotating your hip. That will make it worse. If
it changes the biomechanics.
Yeah, if your glutes or your hip external rotators, these are all things you don't need to know. We're going to mention in the video of how to correct it.
Yeah.
Training habits can also lead to this. If you sit in the lotus position, which is
cross-legged.
Well, I'm an old man, but I can still get it up there.
But you're not crossing your legs.
Well, is this like this, you mean?
Well, that's what I was thinking.
That's more lotus.
Yeah. I don't. know the lotus from the whatever. But
Yeah, anything else?
it's all in the same ballpark.
Sure. If your knees want to bend in, like this, knock knee,
Yep.
especially which again, if your hip is internally rotated,
Yes.
or if your feet are flat, your knees are going to tend to do that.
Sure.
It's funny, Brad, I've heard this mentioned many, many times, and actually I just interviewed somebody on the podcast. Everything that happens to the knee is usually because of something that's happening at the ankle, foot, or hip.
Yeah.
It's not the knee that's going on. It's upstream, downstream. It's something affecting the knee. It's
Upstream and downstream.
Yeah.
Like a river.
Yeah.
Huh.
That's a Kelly Starr term.
Yeah, well, it's amazing how people kind of relate the body to other parts of the world.
I can't remember how that one podcast guest said it was kind of an inconsequential joint, he called it.
The knee?
Yeah,
Oh.
because it was affected by everything else.
Sure, it's just hanging out there, being influenced.
So if you want to, don't run on a surface that is banked or cambered.
Yes, like most roads.
Like the side of a road.
Yeah.
That it can make it worse.
Mm-hmm.
Excessive running uphill or downhill
Yeah.
can make it worse. Brad, you're the man on this one.
What?
Incorrect fit of the bike.
Yeah. Usually the seat's too low.
Right.
And it puts excess stress on
Yeah.
there. And that's probably the biggest common misfit of a bike is the seat's too low.
Sure. Excessive heel strike force from running. Now, Brad and I both have taught ourselves to change our running from hitting heel first
Yep.
to hitting more midfoot first or forefoot first. And that acts as more of a shock absorber then.
Yeah.
And you'll just find out you're going to have less injuries. I mean, it's just, I think it's, I can't think of anybody that shouldn't be doing that, Brad. And this is my opinion.
Right.
Yeah.
And, well, I kind of agree. Although I ran heel strike for many years.
I did
was
too.
very comfortable with it. And then I changed. Hard to change for me. Took a couple seasons.
For me, I actually was getting lots of hip pain when I did heel strike.
Yeah.
I mean, I don't think I'd be running anymore, Brad, if I was still doing heel strike.
Sure.
All right, hiking long distances, like if it's very common in the Army, running up and down stairs, using a rowing machine too, because you're constantly in that 30-degree range.
Yep. With a fair, not maximum force, but you got force on there consistently.
Simple test, very simple.
Ah.
If you sit on the edge of a mat with your knee bent to 90 degrees, place your finger over the bump on the outside of the knee, a little bit lower one usually, or right about, you'll find it. And just bend and straighten your knee. And if that recreates your pain, that's indicative of ITBS.
Yeah. You'll probably find a tender spot, so to speak. It's not global.
You can push around and find it.
Yep.
The other way is to actually stand and place all your weight on the painful knee, and with your weight on the knee, bend it to approximately 45 degrees. And if you feel pain on the outside of the knee, again, a good sign that it might be iliotibial band syndrome.
Yep. This one's probably easier
This one's
to
probably
do.
easier, right? You
Yeah,
don't have
for
to,
the
you don't have to
layperson.
find it. So
Right, because some people will be,
they'll
that
be pushing around.
that fibular head can be confusing with that other part.
So this video, by the way, is a part of a series of videos
Oh.
on knee pain. If you want to find the video on how to fix ITBS or iliotibial
Sure.
band syndrome for good, go to bobandbrad.com, go to the program section, and look in there for the knee program.
Yeah.
And under the knee program, there'll be, we don't even know yet. I'm not even done making them up, Brad. There's probably going to be 40 videos. And watch the ones that pertain to you. You can find the one on iliotibial band on how to treat it. And also, Brad, what else do we have with it?
Well, along with it is a big bonus is you can click on the PDF button. You print out a review of the whole video. You don't have to go back and look at it. And the exercises, and some of them, the exercises have pictures of them.
Oh, sure.
Yeah, so
we try
it's,
to make it, that you could take it with you and perform the exercise without having to go
Right.
back to the video.
Exactly right. And we don't even ask for your email. Completely free, the whole series.
It's our gift.
Yeah, and we've got other series, back series, 10 series,
Yeah, sciatica.
sciatica series, yeah.
Yeah.
So good luck with everything.
Broken heart series.
Well,
we don't have that yet.
That's a tough one, but
Yeah.
we'll work on it.
Thanks for watching.